with that, let's open this conversation to add some insights from two additional panelists. We have Dr. Gita Nair, who many of you may recognize from her TV appearances. She's a national leader in the healthcare space. She is also executive medical director at Salesforce. We also have Terry Sanders, who's SVP of Enterprise Marketing and Communications at HIMSS, which is the Healthcare Information and Management System Society. I think many of you are familiar with. She's also a thought leader around the transformation of the healthcare ecosystem, and particularly when it comes to information and technology. Welcome, Dr. G, as I learn you like to be called, and Terry.
Thank you.
And I will have to say this is officially a fireside chat because Terry has brought fire with her. Thank you.
Well done, Terry.
I did. I brought a little heat to this conference.
Nice.
That's why I came, Terry. So thank you for that.
Yes, and Dr. G has a magnificent chair behind her, which I do have to call out.
That is the math chair. My daughter says she can't do the math or the science. I'm like, get in the chair. It'll come to you. It'll come to you.
Nice. A math chair. We might have to have one of those at our house as well. So, I want to start this conversation on an issue that Jim brought up in our previous chat, and that's mis and disinformation, right? I mean, this has come into full view with the pandemic. We've seen the contents of this sort of evolve from sort of these home remedies in the early days to now much of it's targeting vaccines. So I'm curious to hear sort of your perspective on both the type of misinformation that's really taking hold and going viral, and also what you found is most effective in sort of setting the record straight. And I'm going to open this up to anyone, but if no one jumps in, I'll call on someone.
I can jump in just to lay some context and what we saw with misinformation. The pandemic brought with it a lot of improvements, digital health being one of those, but it also put a tangible stake in the ground, for consumer-centric care. But as we made that shift, it also became sort of glaringly apparent that we have some real challenges with the lack of transparency, access to accurate information. And in particular, we saw a huge surge in social media as a primary channel for sharing misinformation, which the Journal of Public Health defines as any information, right, that veers from current scientific consensus. So we're seeing miscommunications and confusion generated about COVID-19. And we're also now seeing that spring up a lot with vaccine distribution, creating unnecessary, perhaps, concern or confusion around the vaccine, its benefits, what it does and does not do. So we really need to address social media particularly, right? There's an urgent need for communication and getting accurate information out there.
Mm-hmm. And Arthi, I'll just jump in real quick too. So I echo everything Terry said. I think it's fundamentally this concept of health literacy. It's pretty timeless, right? As a doc, I can certainly this is front and center because of the pandemic and the issues around misinformation. But a million times a day, patients come in and say, "Doc, I heard from a neighbor that if I put together ginger and turmeric, then my diabetes will, magically go away." And we have great conversations about things that have been studied and things that have not been studied, and the risk benefit, which is the way we make decisions in medicine, right? But what's so dangerous that we have realized through this pandemic is that when people do make the wrong choices because of literacy issues, access issues to information, timely information, it affects all of us as a community. And so I think that's been exposed. The other part of this that's been exposed is the role for the payer, the provider, pharma, biotech, your audience, frankly, right? Marketing and communications could not be more important. And I think what we're seeing is that particularly in the healthcare space, it was always thought of as a nice to have, but not necessarily a must have when a hospital thought about their business model, or a payer thought about their business model, or a pharma company. And now what we're seeing is that because patients can't find their doctor on social media, or can't find the hospital being the leader on good information, that's why they're going to John Doe on Twitter or Facebook, right? And there's nothing wrong with going to those sources if they're following the right people and the right sources. And ideally that person should be myself, right? Whoever your doctor is, whoever your hospital system is, whoever your trusted advisor is, I think we're realizing that the MarCom role has such an opportunity there. And as we think about digital technology tools, there's an opportunity to really scale those things, right? Because we as docs, nurses can't spend 60 minutes a day just educating folks. So we need that help from the MarCom community, and patients are asking for it. And I think we're seeing as a society, this is a really crucial role to play.
And if I could just add on to Dr. G, she touched on, the connection with misinformation and trust, and the role that trust is playing, where people decide to access care. We saw in multiple surveys, PwC and Deloitte studies come to mind from 2020, where consumers are saying they are trusting non-traditional providers significantly more than traditional. And a lot of that is both the transparency, accurate information, pricing is right there front and center, but honesty, right, and accuracy. So as we see so many new entrants, right, into the healthcare space, and competition is just vastly increasing, traditional healthcare really has to pivot and really think about where they're investing their dollars, or they could lose more ground.
You both brought up 2 points that I want to dig into a little bit deeper. One is, the messaging, especially that we've seen around this pandemic. I mean, the public isn't used to seeing the scientific process sort of unfold in real time, right? And that's led to some confusion, especially when, when we get more data and the guidance shifts, right? But that it seems like that's created this opening for disinformation and for people to be skeptical about science and about the process. So how do you maintain public trust when there is so much volatility that's just inherent in the process?
Sure.
Oh, go ahead, Dr. G.
Go ahead. No, go ahead, Terry, go ahead. You got the fire. You trump everybody. Like the rock, paper, scissors. You got the fire. I'm gonna be quiet.
This really is the time for communicators and marketers to drive home that long and too often questioned value that we deliver to the organizations we serve. The only way for healthcare organizations to be successful long-term in this new era of consumerism and technology-driven care is to pull back the veils, understand your audience groups, communicate to them on the level that they are on. Too often our communications in healthcare are so complicated that you've instantly lost the majority of your audience straight out of the gate. And thanks to technology, the whole world is connected and everyone's watching. So we need to be honest. We need to be targeted with our communications again. One wrong message can be very detrimental in today's world. So honesty, transparency, bring down the level of our communications. Everything doesn't have to be pie in the sky. We need to understand people's education levels. What languages do they speak? We have to really get personalized here.
Yeah, I totally agree with Terry. I think the key is being authentic, right? Authentic. And what does authentic mean? So it means an authentic voice, being authentic with your audience and understanding exactly like Terry said, which is, you're not third grade level. We always say second, third grade level, right? This is, for me, the experience, I always say it's like going to the mechanic. I have no idea what they're talking about when I go to the mechanic, right? I want them to just talk to me like I'm a second or third grader and fix it, right? Fix the issue, fix the car, explain to me what they know, what they don't know. And I think the other thing we have to keep in mind, which I'm very surprised to see some of the messaging even from some of our government agencies, is keeping it relative, right? So when we talk about the vaccine and we say things like, it's not been studied in pregnancy, you automatically, you set off alarms, right? It's pretty terrifying right now if you're pregnant and trying to decide whether to take this vaccine or not. What we don't say is that we don't have a lot of data on pregnant women and vaccines and most medications, period. So we have to put that into relative sort of standards that we have and how we make decisions. And so that's the conversations that we have with our patients, which is, look, do I know what COVID-19 vaccine does in pregnancy? Not really. Do I know what happens with any virus or bacteria in pregnancy? Yes, which is we know that pregnant women are really susceptible to any infection, more so than when they're not pregnant. And do we think there is really strong data to suggest if you get vaccinated, it's a good idea based on your own risk, right? Are you a pregnant woman on the front lines, like many nurses are right now? Or are you hanging out in the basement watching Netflix for 9 months, right? You can skip the vaccine if you're worried, but So it's that kind of language and making it authentic and realizing that it's personalized to your situation, which is what we do every day in healthcare. But the messaging has unfortunately been lost. And like Terry said, because alternative, whether it's alternative health professionals or alternative folks talking about these things are much easier to access than a doctor, nurse, hospital system, payer, provider. That's why people are going there, because they're thirsty for information, right? I had a patient I just saw on Monday, 35-year-old young African-American guy, came in, was on 10 different types of herbals and energy medications and pills, and surprise, surprise, came in with high blood pressure and a little bit of liver failure. And I'm laughing because this is an otherwise 35-year-old young, healthy guy. And my entire visit with him was convincing him and making him understand that all of the stuff he read online, which is who put him on all these medications, in an effort to stay healthy, as he put it, through COVID, actually caused him harm. And I really had to have an honest conversation with him to say, listen, if you have a question, I want you to bring them to the next visit and I will answer each and every one of them. But I actually want you to just stay offline, get off of all of this, and then come back and let's recheck your liver and your blood pressure. And it's, again, the stakes are really high. They've always been high, COVID or not. So again, I am very passionate about this space, and it really is a call to action for Marcom right now, and organizations that are thinking about digital engagement in a new and innovative way, and thinking about the retailization, the opportunities with CVS, Amazon. We don't think twice about going to any of those apertures or outlets if we have a question or we want to buy something. And we need to have the same kind of relationship between patients and docs, so they know exactly where to go and know that they're getting what they're buying.
I have one last question on this, and then we'll move on to talk a little bit about mental health. But one of the things that the example that you gave, Dr. G, that it was so powerful, but it's not scalable, right? So like, how do we have a scalable, nuanced message to meet people where they're at? I think for so long we've dismissed folks that oh, that's the anti-vax community, or they don't believe in science, or they want to take an herbal remedy, but we have to meet some of these people where they're at, especially if we want to achieve herd immunity, right? So have you learned anything in the last 12 months about how you can validate people's concerns? mRNA, it sounds like DNA, is it going to change my DNA? Like, how do you validate that they are concerned or worried, and still inform them, and in a way that's scalable, right? That we can reach, like the patient you reached in your office, that we can reach sort of the masses.
That's a terrific point. So I would say, Arthi, what I've learned, and definitely in my role at Salesforce, right? The hospital systems that are doubling down on their digital engagement investments are clearly coming out as the winner here, right? So simple example with the patient that I talked about, I would love to have been able to say, hey, look at the blog, look at our section on herbals, right? Or here, I want you to follow our Twitter handle. I want you to follow and read these 3 sources that I personally wrote on this topic. And so, if I had a Marcom partner, right, and I was able to point to things that we had already kind of established, and additionally, if I had digital engagement tools, I'd like to say, hey, you know what? I'm going to put you on our digital engagement journey for COVID-19. You're going to get regular messages about, where the vaccine is available, why you should take it, and we're also going to have bidirectional communication. So if you need to come in, you have a question, you want a virtual visit, let's turn that on. When and where you need it, and maybe it doesn't need to be me, Arthi, right? Maybe it's a nurse practitioner or a PA in the office. So to your point, we can scale the conversation, and really what it's about is, we'll call him John Doe. It's about John Doe, and when he watches an ad or he watches something, he panics and says, "Gosh, I'm just going to take the latest flaxseed or whatever it might be." Instead, him having that source of, no, Dr. G said, if I had a question, this was the way to reach her, or she had pointed me to these 3 tools, which is what she supports and her hospital supports, which is where I go, my customized personal trusted source in a brick and mortar system, right? Now in this digital aperture, 24/7, when the patient needs it, very much like Amazon, very much as you're going to see the pharmacies now enter the vaccine space, because they're available and they have the access. That's how they've built the trust, right? Trust is built largely on access. Are you available when I need you? And do you give me what I need when I need it? Right? And that's what this has become. And that's exactly what this patient said to me. He's like, well, doc, I didn't know where to go. And there's so much information about how these energy pills will help me, and so much information about mustard seed, and no one said anything about doing nothing. I was like, did you think about running? Did you think about having some vegetables and fruit? It's like, no, that wasn't front and center, right? So it makes sense. It makes a lot of sense when you think about it, and it's basic. We kind of, one of the things I think that's come out of this pandemic is getting back to basics, right? Good information, less is more. It's back to basics, you know, and it's hard for people to understand. It's hard for him to understand that taking away 10 of his pills would make him healthier, because we have a culture that also promotes this idea that there's a pill for everything, and that you have to constantly do something outside of what you've been given, which is unfortunate, right? And that's again the opportunity we have with the environment we're in.
Yeah.
One more
And I can't
closing
stress the, I'm sorry, Arthi, where she just laid out such technology. And
Yep.
for communicators, we also must stay abreast of technology. We have to be leveraging those tools, and that's how we make our messages scalable. That's how we touch everyone. Tools like Salesforce, CRM, automation tools, and taking those tools and turning them into metrics that sway our internal partners to invest more in what we do.
Yes, and one.
I just had to squeeze that in.
Yes, no, and you actually that touches on what I was going to ask, and I thought Jim might be a good person to respond to this. Jim, you know, because so much of this information, you know, spreads on social channels, some of which are closed channels, right? Like WhatsApp. So you know, brands can't even monitor what's being said about, you know, their therapeutics there. Is there anything quickly, because I'm looking at the time, is there anything that you all have learned in the last 12 months about what you can do on the social channels to at least help mitigate some of the spread of misinformation there?
Yeah, there's quite a bit. You know, there's plenty of programming you can do, you know, through machine learning and AI that will, you know, trigger response. And so you see certain language and you can trigger response and redirect. You know, I think Dr. G mentioned, look, I think what's exciting here is if this was easy, they wouldn't need us. So it gives us purpose and reason to be here. You know, I think it's never been more important. And again, when it's a matter of life and death in these cases, like it, you know, can be, and it matter your health, you know, that's what this is all highlighted. So I think to Terry's point, and we partner with HIMSS now, and that's exactly what they're doing. This technology proliferation, utilizing that to save lives. I mean, literally, we're going to save lives with tech and communications and the combination of those things. And that is a completely new experience, Arthi. And you and I have been talking about this for years, you know, the importance of our discipline. And now it has that level of importance. And even if you hit one person and save that life, we know, and that you're about to go into mental health. And this is exactly where we know that intervention can make a difference in someone, you know, a teen's life where they might have taken their own life, and instead an intervention can change everything. You know?
Yeah, I mean, that's a good point to kind of, let's talk about mental health. I mean, the pandemic exposed how dire the situation is in the US and how much we need mental resources, or more mental health resources here. I'm curious to hear from all of you, you know, how you feel the pandemic has shifted the conversation around mental health. And perhaps, you know, what are some of the innovations that maybe have come from this?
Sure, I'm happy to jump in on this one. So I think first of all, it's an excellent point, and I love Jim's note that, you know, if it was easy, they wouldn't need us. So number one, your audience should feel very inspired to be working in healthcare right now, right? Every part of the ecosystem needs everyone. So number one, I hope everyone walks away today very inspired. You know, number two, and I'm going to keep going back to John Doe because this just happened to be my patient on Monday. You know, when we dug into a little bit, I asked him, you know, why was he spending all this time online researching all these things? And it turned into a mental health visit. He basically said, listen, doc, I live alone and I'm really lonely and I don't have anyone to talk to or debate these questions with. So I find myself going online and reading other conversations and entering chat rooms. And, you know, it's changed everything. The way that we think about mental health, right? The stigma, you know, hopefully is is going away more and more with more time, in that there's a sense of a communal sense of everyone is not at their best right now and challenged. There's definitely more empathy all around, and that folks are understanding there's probably something going on, right? Where when you find someone and have an interaction that perhaps isn't ideal. And on the clinical side, what we're finding is certainly an overwhelming use of virtual health, specifically for mental health, right? We've found that folks are seeking help, and because they're able to do it so easily in these virtual apertures, and that physical exam portion is not required, people are much more open to that. And again, it just goes back to all the things we talked about: scaling, using digital engagement. And again, I would argue that it doesn't have to be a mental health visit. There are many things you can do on telehealth. This entire conversation, this entire visit with John Doe from Monday, I could have done virtually, right? So these are the things that we have to start thinking outside of the box. But I think that the digital engagement Marcom aspect is how you start that conversation, right? And then you give the opportunity for those visits, whether in person or virtual. But this is fundamentally a very important issue in our communities and society, and we need to continue to invest in mental health and resources.
Yeah, absolutely. And with that surge in virtual visits, I'll ever miss an opportunity to just point out that that was made more possible, right, by waivers that we implemented CMS via Congress to allow and for virtual visits and to support that reimbursement model with the doctors. And so that's a temporary change. And if we want to carry this good improvement forward in mental health, as Dr. G says, removing the stigma and people are accessing it much more, we need to make sure that we keep those things, those waivers in place permanently.
So, Jim, I want to ask you, in terms of whether your mental health resources that you offered your own employees changed during the pandemic, because, even before this happened, PR is a high stress, deadline driven industry. And, it is 70% women in the workforce as well. And as we all know, this pandemic has been particularly brutal to women, and particularly women with children. I'm curious if you all changed any of your offerings as part of the pandemic.
Yes, we did. We added on, and our provider did, but we also went out and sought programming. We actually tailored a whole program across the board for all of our people as the workforce grew by quite a bit anyway. And, we also are, business, well, they were called employee, but now called business resource groups, also became, a place where people could go to share stories about, hey, here's how I deal with this every day. So we had, a parents group that helped each other. I employed a child and family services expert, to access, in addition to, just talk therapy resources, because all of it dealt with anxiety, depression, all the different things that were coming up related to this. Plus, we were holding a weekly town hall with subject matter experts. I brought in, experts in the field of, virology and epidemiology, just to, and this is something any of us can do with our companies and should do, and I encourage it. That's where this starts, educating your employee base. Your workforce is so important as a starting point. So we have the capability and power to do that. And I think that also, helps the situation. But, that is where a lot of this starts. We're sitting most of the day, and we're in this, kind of glowing atmosphere. You absolutely have to have these resources to have a productive workforce.
With just a few minutes left, I want to kind of address this, the conversation around return to normal, right? We're hearing a lot more of that as these vaccines roll out. And there is so many assumptions that are baked into that phrase. And even the public health experts, or at least the ones I follow on Twitter, there doesn't even appear to be an agreement amongst them. Do we Do we need 1 dose to return to normal? Do we need 2? How long do we continue masking? Are we masking into 2022 or 2023? So, with, to our point earlier about how, we're shifting guidance based on real-time data, how do you level set this question? Dr. G, with your patients, Jim, with your employees and clients, Terry, with the HIMSS community, which is quite large and diverse. I'm curious to sort of get your thoughts on this.
Sure, I'm happy to take this one. So the way we talk about it, first of all, the reality is that we're not going back to normal, I think, anytime soon. I think folks need to get their head around the fact that 2021, everyone needs to wear a mask, everyone needs to get vaccinated. But for this year, that really isn't going to change, right? We'll see in 2022, but I think we need to first commit to that just as individuals. When we have talked to customers, what we really talk about is how do we get to the new exceptional, right? Because we actually don't want to go back to the normal in healthcare. I think that it's fair to say that healthcare has been broken for quite some time. All the infrastructure, cultural issues around burnout, cultural issues around health literacy, mental health, all the things we just talked about are broken, and the pandemic has exposed them. So now it is talking to hospital systems about the new exceptional in care. And how do you become that new exceptional when you think about customer engagement, patient engagement, virtual health, and how do you build the infrastructure? Legacy systems help contribute to some of this, right? The EHR, the ERP systems, we need them. We continue to need them, but the legacy systems are not going to get us to the new exceptionals. And that's where we think about a platform like Salesforce fitting in or CRM technology fitting in to say, look, investing in digital infrastructure to meet not just the pandemic, but to meet tomorrow's healthcare, because now you have a consumer that, number one, is going to CVS, going to Walmart and saying, hey, this is pretty good. Maybe I'll stay here, right? And what they're not appreciating is many of the cradle to grave longevity of care that you get in a hospital system, or to see a specialist like myself, you're never going to get that at CVS or Walmart, right? And so what is the difference in a quality outcome based on your individual disease? And how do you think about that value prop as a hospital system, but make it so clear for the consumer that doesn't necessarily intuitively know these things, right? But that's really what it's about. I don't think it's about getting back to normal. Definitely in healthcare, we don't want to go back to that. We want to do way better, think smarter, faster. And again, I always look at the financial industry, the hospitality industry. When you think about what they've done to customer service, meeting the demands of the consumer now expecting, just go straight through to the gate. Why would I ever stop, right? I don't even know the last time I went to a bank. So that's what we have to think about in healthcare, is we have to flip it on its dime. But digital engagement, all of Marcom, it needs to be together, right? That has to be considered together. The digital engagement for care, as well as the Marcom and the messaging and the trust building have to go hand in hand.
Terry or Jim, did you want to address the sort of back to normal question? This may end up being our last question for the day.
I'm happy to jump in, Jim, or if you want.
Go ahead, Terry.
As Dr. G said, we are not focused on returning to normal. We are very much so focused on creating something new and better. She said something exceptional. So we've been talking with Congress from a government relations perspective on these rules, focusing on interoperability, connecting systems, working with non-traditional providers, right, like Salesforce, Google, and Amazon, having those discussions. We all need to be at the table. And so we'll be advocating for both interoperability. We're going to be advocating for those waivers to stay in place that are going to allow both providers and consumers more flexibility and access to care. And I can't stress this part enough for the communicators. Many health organizations today deprioritize their investments in marketing and communications, but it is the heartbeat of their bottom line. There is no business development, there's no revenue without Marcom. And so best practice is for our budget to be sitting between 5 and 12% of an organization's total revenue. So take a look at, how much is your company investing in you? And I have to challenge, communicators within the health space to press upon their organizations for greater investment. If you're not focusing on marketing and communications with the trends that we're seeing in consumerism and technology, then you could be in jeopardy.
Well, thank you. I think we're just about at time here. So I just want to take a moment to thank all three of you for joining us today. Dr. G, we did not get a chance to talk to you about delivering Amazon-like experiences for healthcare, but it is really interesting. So I recommend anyone who wants to learn about that to just probably Google Dr. G and see a talk that I think you did at JP Morgan, healthcare on this topic, since we didn't
Well,
get a
that's
chance
the
to-
normal. That's the normal. That's going to be
Yeah.
where this goes. So that's what we're all talking toward. And
Yep.
that's the way I tell clients and my people, that's what you're gunning toward. It's all about automation, patient power, consumer power. That's going to be the expectation. They both said it, and that is how you're going to have to design your programming.
Yeah.
And thank you, Arthi. I think we did. I think we hit a lot of elements of it. So thank you for that.
Yep.
Well,
Great
thank you
job.
all.
Thanks.
And because of course this is the U.S., it seems fitting that we jump from healthcare to now talking about politics. So I'm now going to hand things over to Paul Holmes, who will lead our next conversation on how the disrupted public is repositioning a role for public affairs. And there we go. There's Paul. And thank